Hey there! Dealing with a herniated disc? Let's talk about the most common mistakes that could be making things worse. First up, sitting. Spending too much time sitting, especially with poor posture, can put extra pressure on your lumbar spine. So, make sure you take breaks and stretch. Next, looking down at your phone or computer. This can strain your cervical spine, leading to more pain. Try to keep your screen at eye level. Bending and lifting incorrectly. Another biggie. Always bend your knees and keep your back straight when lifting objects. When you rise from a seated position, do it slowly and with support if you need it. Rushing can put unnecessary strain on your spine. Standing for long periods can also be problematic. Shift your weight from one foot to the other and take breaks to sit or lie down. Now here's a crucial point. Many movements might produce or increase your pain initially, but if the pain calms down after the movement, it's not necessarily making things worse. However, if the pain doesn't go away, spreads down your arm or leg, or obstructs movement, that's a sign your symptoms are worsening. Pay attention to your body. It's common advice to rest and stop all activities when dealing with a herniated disc. But this isn't effective long-term. In fact, it can make symptoms and fear of movement worse. Gentle movement and staying active can actually help you manage your pain better. So, avoid these common mistakes. Stay mindful of your movements and keep active. Your spine will thank you. Thanks for watching, and don't forget to share this video with anyone who might benefit from it. Stay strong and take care.